First, there are 13,867 cumulative confirmed cases of coronavirus in Victoria. That's 450 new cases since our last update. There have tragically been now 181 people in Victoria pass away because of this global pandemic. That's an increase of 11, so 11 further deaths since I updated you yesterday. One female in her 50s, two males in their 70s, three males and three females in their 80s, and two females in their 90s. We of course send our best wishes and our sympathies to the families of each of those 11 Victorians, and the great difficulties that they will be experiencing at the moment are acknowledged. They're in our thoughts and our prayers. 7 of those 11 deaths are connected to aged care settings. There are some 607 Victorians that are in hospital, with 41 of those receiving intensive care. To date, there are 1,527 confirmed cases in healthcare workers. That's 139 more than yesterday. And there are currently 911 healthcare workers who are active cases. I'll come back to that in just a moment. There's 2,454 cases with unknown source. That's in aggregate, 66 since yesterday's report. So 66 additional mystery cases. That number is lower than it has been in recent days. We're obviously pleased about that, but still far too many of those community transmission mystery cases that we can't find the source or the circumstance behind that infection. I don't have an aggregate number of tests for you today. As I've said a couple of times now, we're moving very much to an exclusive focus on the positives, so tallying up all the negatives is a slightly delayed process, but I can confirm that laboratories have confirmed for us that there's around 25,000 tests, at least 25,000 tests conducted yesterday. There are 7,637 active cases across the state, and 1,548 active cases in connection with aged care. Can I just go back to the health worker infection issue and just again make the point that I've made many times, but I think it's worth making again. Our nurses, doctors, ambulance paramedics, cooks, cleaners, orderlies, ward clerks, everybody in our hospital system, they are not the front line, they are the last line of defence, and I would just ask all Victorians to follow the rules to protect themselves, but also to protect our dedicated healthcare team. They are heroes. Their courage and their compassion and the care that they provide is just amazing. And the best thing we can do is to follow each of these rules, make good decisions at a personal level, because that will not only keep us safe and every other family safe, but it will mean that our healthcare heroes are exposed to less of this virus, have to treat less patients, and their work is truly honoured by us doing that. That is the best way for us to say thank you to them. Now, I've got an update in relation to ADF and authorised officers from the Department of Health, the door-knocking program that they have been undertaking. I can confirm that the joint ADF Department of Health teams have conducted more than 5,000 home visits since the 22nd of July, when the program began. Yesterday there were 60 joint teams, including 120 ADF personnel, and there'll be more that are arriving over the course of the coming week. That links back to the announcements I made and some of the detail I gave you a few days ago about an additional 500 plus ADF staff coming to join us. Yesterday, for instance, there was those 60 teams. That was at least 120 ADF plus some Department of Health authorised officers. They conducted 1,150 visits. That's the biggest single day effort since the program began, and that number will only increase as we move beyond simply door knocking. This started with people we couldn't get in contact with who were positive, and then instead of doing interviews over the phone, we were doing interviews on their doorstep. Then it moved to all positive cases being door knocked, and then it will progressively move to all close contacts being door knocked as well. And that'll be random, that'll be repeat door knocks that are all about making sure people are doing the right thing, and that we can provide support and assistance to anybody who needs that. So 1,150 yesterday, the biggest day so far. People were home, pleasingly, for 1,000. These are rough numbers. 1,000 of those 1,150 people could be found where they were supposed to be. The 150 who could not, they have been referred to Victoria Police, and I can confirm that there are around 500 people who are not where they should be. This is cumulatively, and they've all been sent to Victoria Police, and Victoria Police are making inquiries as they do with those 500 people. I do hope to be able to provide you with an update on the outcomes of the work that Victoria Police has done, perhaps over the course of the weekend. But that is certainly a smaller number of people that could not be found at home than we have seen, and I'm very grateful to those Victorians who are doing the right thing and are where they should be, and that is away from other people, isolated at home, doing everything they possibly can to look after themselves, of course, but to look after everybody else by not spreading this virus, by not coming into contact with others. I know it's very challenging. That's why visiting is important, I think, not just for compliance, but for the purposes of information and clarity and providing support to anybody who might need it. And everyone's different, everyone will have different needs. Some people have particularly well established support networks that they can fall back on. There are many other people who don't. So those door knocks serve a number of purposes, all of which are very important. As I said, if I can get you further, I will get an update over the course of the weekend in terms of Victoria Police's investigations and the other work that they're doing around people who should have been at home and were not at home. I again stress there may be lawful reasons for that. Addresses may be incorrect, people may be doing their ISO somewhere else, but it is clear there are some people who are not, and that's why Victoria Police have additional powers, additional fines that they can levy, and I'll come back to you with some further information on that over the course of the weekend. In general terms, I just want to say thank you to every single Victorian who is doing the right thing. I want to say thank you to industry who have been across the board, large and small, every part of the state, every sector. We've been working so closely with, and I'm very pleased to see lots of acknowledgement today from lots of different quarters. Not about thanking me, but thanking the team of people who have been engaging directly, and it's very pleasing to see that that dialogue, those important discussions, have delivered us not an easy set of decisions, but the outcome we need. And just driving in this morning compared to yesterday, there are significantly less volume on the road. That'll be confirmed by data over the course of the weekend, I'm certain. But these are the decisions we have to take. It's heartbreaking, it's very challenging. But unless we drive down movement, the number of people moving around Victoria, we won't drive down the number of coronavirus cases, and then we will remain in these terrible conditions, these very challenging rules, for much longer than we otherwise would. That's not what we want. That's not the advice of the experts. There is a lot of pain here, but ultimately there will be significant gain for all of us when we can move to reopen, when we can move past this second wave. I think that probably covers off each of the items that I wanted to go to. Of course, we're always happy to answer any questions you have, but before then, the Deputy Premier and Education Minister has got some very significant announcements in relation to support for school students, particularly senior students, welfare, mental health, but also some announcements about how the balance of Year 12 will play out.